Hi, David Moliterno. I'm the editor-in-chief of JACC Cardiovascular Interventions, and we're here in Paris at EuroPCR, and I'm with two of my friends and colleagues. I have on my left Julia Grapsa, who's the editor-in-chief of JACC Case Reports, and then Davide Capodanno, who is the editor-in-chief of EuroIntervention. And we're here because we wanted to talk with you about some ideas, one of which is centered around EuroPCR and how it's very case-based. Part of their philosophy for learning and sending forth information is by centering many of the lectures and things around cases. And so I was going to first ask Davide about that, since he's been a leader in this meeting for a while and has helped to design some of the sessions. So Davide, tell us more about this.
David, first of all, thank you for having me. And the motto of EuroPCR is buy and for. And this is really a general principle and philosophy that works very well when it's delivered through sessions. So essentially, these are designed by doctors for doctors, and it's not by chance that they start with a clinical case, because this is a common scenario that aligns everyone. Of course, everyone has an opinion regarding how I would treat this situation, this anatomy, or this kind of comorbidities, etc. And this is a good milieu for the discussion. And then, of course, you try to inform and enrich the discussion with some science as well, because you need also some evidence to guide through some difficult decisions. But I think this is really the hallmark of EuroPCR. Starting with a case, find a common ground for discussion, and then share. This is really the common language that we speak here.
Well, it's absolutely worked, and we'll branch off into some other topics, but let's just hear from Julia, since that's really the foundation of JACC Case Reports, is taking the vignette, like David described, but then building upon it.
So it's very important, as you say, David, and Davide just mentioned, it's very important to have a clinical case-based discussion. And for example, everything that we know about cardiology, the guidelines, any gaps in evidence, any our everyday clinical practices are being reflected by the clinical cases. Even, for example, like first in human that we publish, of course, across ESE journals and JACC journals, they make such a huge difference in our practice. And also cases that they highlight the comparison of ESE, for example, in the ACCHA guidelines. So there is an endless spectrum in education and how we have transformed education with clinical cases.
Yeah, case-based, that's how it works. So again, here with the editors, and thank you for that little information.